Good day. If you're watching this, you're likely deeply involved in healthcare at system level, at institutional level, or at investment level. Today, I want to speak directly to you, not about another digital health app, but about infrastructure. South Africa has 61 million people, approximately our 650-700 billion annual health expenditure, 8 to 9% of GDP spent on healthcare, a public system serving the majority, a highly developed private sector, national health insurance reform underway, and yet long-term outcomes are determined between visits, between prescription and behavior, between discharge and compliance. Briea introduces a new category, proactive AI health execution infrastructure. We are looking for national strategic partners. Let's look at the reality. Around 57% of deaths are caused by non-communicable diseases. Over 30% of adults live with hypertension. Diabetes affects roughly 1 in 9 adults. Approximately 7.8 million South Africans are living with HIV. Mental health treatment gap exceeds 75%. Chronic disease is expanding. Costs are expanding. But disease is continuous. Healthcare interaction is episodic. Execution collapses in between. And that collapse is expensive. Public hospitals discharge thousands of patients daily. But structured long-term follow-up is limited. Private hospitals deliver outstanding acute care, but behavior after discharge remains unenforced. Medical schemes process billions in claims, but they do not influence daily discipline. Pharma distributes world-class therapies, but adherence often declines silently. Care plans exist. Execution fails. That is the gap. Digital health today largely informs, records, reimburses, Briea, initiates, reinforces, confirms completion, escalates risk, sustains continuity. This is not an engagement app. This is behavioral infrastructure. 5 core differentiators. First, proactive architecture. The system initiates interaction automatically. Second, true omnichannel. Full functionality on app, WhatsApp, and voice. Third, multilingual by design. South Africa has 11 official languages. Infrastructure must reflect that. Fourth, full-spectrum integration. Wellness, fitness, chronic care, mental health, post-discharge diagnostics. Fifth, execution confirmation logic. Not just reminders. Confirmed completion, follow-up sequencing, escalation. That combination creates defensibility. 2 AI layers power this. Agentic AI, which detects missed actions and triggers structured outreach. Generative AI, which personalizes communication based on condition, language, and context. Together, they create execution orchestration. Population scale. Mobile penetration exceeds 90%. WhatsApp usage is dominant across income levels. Connectivity varies across provinces. Briea operates fully on WhatsApp, with voice for low literacy populations. In low bandwidth environments, adoption drives engagement. Engagement drives measurable health stability. In a country with 11 official languages, communication matters. Language gaps create medication errors, reduced adherence, lower trust. Briea communicates in the patient's preferred language. For national scalability, that is infrastructure, not convenience. Briea integrates the full health journey, preventive wellness programs, structured fitness plans, chronic disease stabilization, mental health screening using validated tools, post-discharge recovery pathways, diagnostic reinforcement cycles. One engine, one longitudinal system. Chronic disease drives. Claims inflation, hospital admissions, long-term disability loss, productivity. Chronic disease is stabilized through rhythm, medication rhythm, lab monitoring rhythm, lifestyle discipline. When rhythm stabilizes, catastrophic escalation declines. That is measurable cost containment. Mental illness affects roughly 1 in 3 South Africans during their lifetime, yet most never receive adequate care. Briea integrates continuous screening, private, stigma-free, voice-based. Prevention scales. Crisis intervention does not. Discharge is the highest risk transition. Medication errors. Missed follow-ups. Lifestyle relapse. Briea converts discharge into a 12-month structured pathway. Without expanding payroll, continuity becomes automated. For schemes, chronic instability equals volatility. Briea provides daily behavioral engagement, adherence tracking, preventive lab prompting, early risk signals. This shifts the scheme from passive payer to active stabilizer. Globally, non-adherence in chronic therapy can approach 40 to 50%. Persistence equals outcomes. Persistence equals revenue stability. Briea reinforces dose scheduling and structured journey tracking, without interfering with clinical authority. South Africa faces nurse shortages and workforce migration. Briea acts as a digital care coordinator, multilingual outreach, chronic continuation, adherence documentation, extending care beyond the walls. Chronic disease and stress impact productivity, energy declines, absenteeism rises. Briea reinforces daily discipline, sleep, movement, stress, nutrition. Wellness becomes measurable infrastructure. NHI prioritizes universal access and chronic disease control. Scaling preventive engagement across 61 million citizens requires automation. Briea delivers structured, multilingual, low-cost outreach. Execution at national scale, without expanding bureaucracy. Fully AI-powered DIY mode for population-scale deployment. Hybrid AI plus human coach mode for high-risk cohorts. Flexible across schemes, corporates, hospitals, government. Infrastructure adapts to verticals. South Africa has telemedicine. It has claims systems. It has wellness platforms. Very few own daily behavioral execution across the entire health spectrum. Briea becomes foundational infrastructure. Multiple monetization pathways, per member licensing, per patient deployment, corporate subscriptions, pharma support programs, government contracts. Horizontal architecture compounds value. Healthcare spending will continue rising. Chronic disease will continue expanding. Mental health will continue pressuring the system. Without execution, escalation continues. Briea is proactive, multilingual, omnichannel, AI orchestrated, holistic. This is South Africa's missing execution layer. If you believe infrastructure, not apps, is the future, let's build it. Thank you.